Urinary tract catheterization, pages 158 to 159. Urinary catheters provide access to the urinary bladder via the urethra to administer radiographic contrast material directly into the bladder, collect urine for urinalysis, relieve urethral obstruction, maintain urine flow, and provide a closed urinary collection system for precise monitoring of urine output, collection of contaminated urine, and patient cleanliness. Urinary catheters are available in a variety of materials, diameters, and lengths. Figure 6.33. Metal urethral catheters can be used to catheterize a female dog temporarily but can cause hematuria and potentially serious injury to the urethra and bladder. Sterile polypropylene urinary catheters are ideal for temporary female catheterization in lieu of a metal urethral catheter. Short, olive-tipped metal catheters can be used to relieve an obstruction at the tip of a male cat's penis. Softer, red rubber catheters should be used for male urinary catheterization or for continuous urine collection in male cats or small dogs. Careful placement of the most flexible, smallest diameter catheter minimizes trauma to the urethra and bladder. However, an overly small catheter diameter may allow leakage of urine around the catheter unless a Foley catheter, containing a balloon, is used. Always examine the catheter for defects and test the bulb of a Foley catheter before use by gently inflating with sterile water or saline before placement. Overinflation of the Foley balloon may cause urethral trauma or rupture. Use the smallest amount of saline required. Most Foley catheters will indicate the amount of saline needed for balloon dilation on the inflation port. Complications of urethral catheterization include iatrogenic ascending urinary tract infections, catheter breakage, and trauma to the urethra or bladder. Urinary catheters must be placed aseptically. Indwelling urinary catheters that are left open and exposed can lead to infection. A closed urinary system can decrease infection rates. Changing the collection system and, only if possible to replace easily, the urinary catheter every 72 hours also helps prevent infection. Daily nursing duties include inspecting the system for kinks and blood clots, cleansing the vulva or prepuce with an antiseptic, and emptying the urine bag at scheduled times. Urinary collection bags that prevent retrograde flow are also beneficial for preventing urinary tract infections. Most healthy cats require sedation or general anesthesia to place a urinary catheter, but very sick cats may not require chemical restraint. Most dogs do not require any chemical restraint and can be physically restrained. All patients should be placed in lateral recumbency for urinary catheterization. However, female dogs may also remain standing or be placed in sternal recumbency. Male cats may also be placed in dorsal or lateral recumbency.